of electronic meeting, offering public access to our meeting as well. I want to remind everyone, this is Bob Vero, I want to remind everyone that the meeting is being recorded and that the recording of this meeting will be available within 24 hours. So I need a formal motion, if I can, as we start the meeting, to acknowledge that we're going to run the meeting virtually. Can I have a motion for approval for virtual conduction of this meeting?
I move to approve the virtual meeting.
I second it.
Thank you. All those in favor? Aye?
Aye.
Aye.
Okay. Any opposition, like sign? All right, thank you. Motion passed.
Only items on the agenda.
Yeah. You have a copy of the agenda. Just want to remind you as well that the only items that will be discussed during tonight's meeting are those items that have appeared on your agenda that you received in accordance with prior notice requirements for tonight's meeting. So we'll delimit our meeting agenda again to just those items on tonight's agenda. You go ahead and take roll. Yeah.
Okay, so we'll do roll call here. Dr. Vero?
Here.
Angie Thompson here. Katina Beard is not with us tonight. Cmhsi Brunner? Cmhsi? And we know Cmhsi's here. Monty Burks? Monty, are you here? Please unmute. Okay. Judge Calloway?
Here.
Thank you. Judge Eisenstein?
Here.
Robin Nobling? We know Robin's with us. She mentioned. Jamison Norton?
I'm here.
Thank you, Jamison. Mary Lyndon Salter? Okay. Pamela Sessions? Pamela noted she was here earlier. Dr. Stovall?
Here.
Thank you, Pamela. Dr. Stovall? Okay. And Dr. Webb? And Pam Womack?
I'm here.
Okay, thank you.
Did we acknowledge whether Dr. Stovall?
Dr. Stovall, were you able to unmute?
He is trying to get on. I just forwarded him the link. He should be on momentarily.
Thank you.
Okay,
Thank
we've
you,
got it.
James.
Okay, thank you, Jameson. Okay, very good. So we have quorum, so we can
All right.
proceed.
So we have quorum. Let's move forward. Just general acknowledgement. Think about the theme of tonight's meeting, what we're capturing and will accomplish this evening. We've set aside time tonight to hear from several community initiatives, which have been part of our council's invested interest for the past couple of years since our inception. We're going to get some general updates tonight, some new information as well from those initiatives. And in addition to that, we've invited Judge Blackburn, Mental Health Court, to join us this evening. She's actually coming in tonight in her role as co-chair for the Communities Committee of the Policing Policy Commission. We know there's a lot that is happening within the overall commission, but especially within the Communities Committee. We think there's significant interest and overlap between the work of this council and the work of that commission. We're going to be hearing from Judge Blackburn tonight as she shares with us the role of that commission, and in particular, the focus of her committee, and then where she sees as well opportunities for input and interface with our council. So she'll be joining us tonight at 6 o'clock. We'll be monitoring all presentations as we move through the evening to make sure that when she joins us tonight at 6, we have adequate time for that discussion until the end of our meeting at 6:30 tonight. So thank you. You have minutes from August 6th. I would entertain a motion for approval of those minutes.
So moved. This is Dan.
Judge Eisenstein, thank you. Is there a second?
Second, Pamela.
Pamela, thank you. All those in favor? Aye.
Aye.
Any opposition?
Aye.
All right, so then, is that one opposition? Or a late, that was a late yes. Okay, the unanimous approval of our minutes for August 6th. Thank you. Angie.
Okay, very good. Thank you, Bob. So it's my pleasure to introduce the ACE Nashville panel that will be here tonight. Charity Ingersoll is the co-chair of the Trauma Informed Care Work Group. She's a clinical director of school-based programs at Vanderbilt, in Vanderbilt's Department of Psychiatry. And then Annie Perezan, who also co-chairs Trauma Informed Care Work Group. And Annie is the director of Love Before All. So as we've structured this, when we have these presentations, we've also asked for BWAC members to be champions for various issues. And so tonight, Judge Sheila Calloway is going to be the BWAC champion. So I'm going to turn this over at this point to Judge Calloway.
Thank you, and I'm excited about this role. I am definitely excited about for us, for a community, and making sure that ACEs is on everybody's mind. ACE Nashville has presented to us previously and presented a platform for us previously, just for us to make sure that we are advocating for their needs and what they're asking for, particularly with the mayor and the council. And so I'm going to turn it over to Charity now, so that Charity and Annie, so that they can, I guess, let us know what that they are asking for, wanting us to help champion at this time.
Thank you very much. Good evening, everybody. Thank you for having us here this evening. I'm going to start us off, and to do that, I'd like to focus on things to be built. So we're looking in an effort to increase awareness of the childcare crisis and lack of adequate access to quality, affordable early learning centers. We would ask this group to promote a screening of the documentary film No Small Matter. So this would be for the mayor's office, Metro Council, appointed members of the boards and advisory bodies, and members of the Nashville business community. Now, we recognize the logistical difficulties related to COVID that really impacted our last screening, and we are definitely committed to learning and growing from it. So for our next screening, ACE Nashville is committed to engaging BWAC in a more dynamic partnership to promote the film No Small Matter. We would do this by engaging in earlier communication and having more of a dialogue, among other things. Also, the Bodecker Foundation has already committed to funding another screening. I'm going to pass it over to Annie. We're going to play ping pong a little bit tonight.
Yes, and another ask we have is a recommendation for contact at the mayor's office or Metro Council. One second. I am. Sorry about that. Yes, so a recommendation for an appropriate contact at the mayor's office or a Metro Council member on the Budget and Financing Committee who can offer advice or any insight around advocacy efforts. And I'm going to pass it on to Charity next again for the next ask.
Now I want to focus a little bit on sustaining. So we would ask that once again, May 14th be proclaimed as ACEs Awareness and Trauma-Informed Day of Action. This is to continue to promote awareness and positive action towards mitigating the ACEs and trauma in our community. This is particularly important in light of the impact of COVID and the tornado.
And knowing that, and again, sis, knowing that language is incredibly important in influencing and impacting policy, we are asking that we trauma-informed language and ACE language from the Building Strong Brain training in city documents to help maintain a cohesive message when we're talking about trauma-informed care and ACE in the city.
And finally, we have some things to be explored. And I think actually Annie was going to kick off this first part for us of the to be explored.
So yes, ideas that we want to explore are initiatives to support MNPS, because we already know the lifelong impact that ACEs has on us. And we have no idea, or we can't even anticipate how COVID is going to impact childhood. So we are exploring ways to support MNPS with mental support in the schools. And Charity has a couple of statistic that she's going to share just to kind of show some of the impact that COVID is starting to have on childhood in general.
I think this particular piece is incredibly important and a top priority, especially in light of any potential, budget cuts or due to the referendum. But I think one thing I really want to hold in front of us is talk a little bit about the impact of COVID and what some things that we could do. Like, for instance, we know that the number of reporting during the peak stay-at-home orders, reporting of suspected child abuse dropped by 27%. That was from the Child Wellbeing Task Force initial COVID impact report is where I got that information. So, for example, in April of 2019, 11,000 calls were made to the child abuse hotline. In April 2020, it was 6,677. It's not because we've done a fabulous job of eradicating suspected child abuse and/or child abuse. It's because the oversight that is normally afforded these children is not in place. The coaches, the religious leaders, the teachers, the doctors. So we know that we're probably, as the children come back physically into the schools, that we're going to have quite a few, I like to call them cherubs, quite a few cherubs that are probably going to really need some support. So increased access to school-based trauma-specific mental health interventions. We already have some programs in place in MNPS, like Bounce Back or restorative practices to put an assistant in every school, an SEL coach, a behavioral specialist, or most hopefully a trauma-informed practitioner in every school so that they can help that school engage in trauma-informed prevention and intervention for the teachers and the students. We need to support our teachers to know how to support their students and then to provide that actual mental health support to the students. We want to be able to do this again in light of COVID, and let's not forget the tornado that tore through our community as well. It's my own personal theory that a lot of the kids out there haven't really had a chance to grieve any of that yet as well. And I think, looking at my notes, I believe that is the biggest ask at this point is to support these access in the school. And so now, Judge Callaway, did you have anything you wanted to add, or should we open it up to questions?
Thank you. I'll at this point open it up for any questions of the BWAC members. If you all have any questions for Charity or Annie at this time as to their proposals for ask for ACE Nashville. And do we have a question?
Yeah, this is Angie. I was wondering if you all had any information on what kind of funding that you think would be needed, the amount of funding that would be needed to accomplish the enhancements in the public schools.
So I know one of the reasons why it's an idea that we're exploring is because we don't have a specific number as to what that number would be. That's why it's an idea that we're exploring as to what exactly that would look like and how much it would cost.
Thank you.
About before this meeting today was the issue of the budget constraints for Metro, along with the possible referendum that may be on the ballot in December that may change the taxes and what money comes into the government. And so one of the things that Charity and Annie definitely want to emphasize is that no matter what gets cut from the Metro budget, what gets cut from anything, that we as ACE Nashville and then as a BWAC organization, that we have got to support our youth, and particularly as they're going back into the school system, whether it's virtual, whether it's full time, in person. That there is absolutely no more time than the present, the urgent time to make sure that we're providing all of the support services for our youth. Charity or Annie, do y'all want to that?
No, I thank you. That's absolutely right. To make this the top priority and to support them. I think the other nice thing to remember is that children are in school 6, 7.5. Oops, did I pause? 6, 7.5 hours a day. So we have a really great opportunity to help them through this during the school. And so if these programs are well funded and it is this top priority, then we can help ensure that we are getting the kids what they need, whole child education and mental health.
If I can go back to the top of we're talking about the viewing of the No Small Matters, particularly talking about, and I think we have already heard a number from Department of Human Services about the number of child care centers across the state that are closing due to COVID and all of the issues going on. How does that affect our children? We're going to try to do with no.
Sorry, it was cutting in and out a little bit for me. I think you're asking how are we hoping that this will impact having this screening? Is that what you were asking, Judge Calloway? Okay, all right. So we know that there have been a number of closings. The original statistic we had was slightly off, but I think impacting the children when they are at their youngest and providing those early child education centers and access to quality childcare supports them, begins to support them lifelong. And we're hoping to bring the crisis to the business community through this viewing of No Small Matter, and hopefully to engage the business community in setting up some of these centers or, making sure that they're in more places, whether it's right there in their building or maybe somewhere just down the street, so that there is more access and we can support our kids in this way. Does that answer your question, Judge Calloway?
Absolutely. I think my internet is low or something, so I apologize to everybody.
It's 5 o'clock. That's when everyone comes home and the internet gets wonky.
That's it. I think I got one more question. I'm going to go with that. One more question. One of the easy things we can do is definitely to support May 14th as ACE Awareness Day. Tell us a little more about need for support council, a particular council person in the mayor's office, how we can support ACE Nashville and all of our efforts, making sure that we got somebody that can explain the budget process and explain everything that goes. Did I lose you at the last half again?
A little bit, but I think, if you have a day that is focused on ACE awareness and trauma informed day of action, just to keep it in everyone's awareness and forefront so that we always have this in front of us and we're always focused on it. What can we do to mitigate these behaviors? And a whole day that's focused on that really helps in that aspect. And then also in having an appropriate contact from the mayor's office or someone that could help, a member of the budget and finance committee who can help us with the understand the budget process, that can help inform our advocacy efforts, like where we should and would want to focus towards this end. I don't know if Annie has anything to add to that.
I'm having an interference with internet connection. I'm so sorry. But yes, I agree with everything that you said.
Wonderful. I'm having that same interference problems. Anything else from the BWAC committee? Anybody questions for Charity or anything?
Bob Vero, maybe just a comment in support of, as you're talking about having a trauma-informed practitioner in every school. I think you just clarified for us there's not a budget for that yet. You're working on it. I think, especially given all, right, the pressures that are being felt these days, you just acknowledge the pressures that are on city budget, as well as the emotional, psychological pressures that are being felt right within schools, parents, teachers, students. Just encourage you to look at that too in a way that if it's not a single person, in every school, is there a way to launch this thing with trauma specialists covering maybe multiple schools in the first year? Again, it's just that encouragement to look at multiple ways in which this thing can be launched and have high impact, especially when we know that the ask is being made in a very difficult and restrictive fiscal time. So it might be a couple of creative ways to look at that.
I would agree. And Metro does have several different ways that they are addressing it. I think, for me, it would be continuation of those different ways and then adding to make sure that the budget is in there to do that.
This is Angie. I wanted to comment on the including ACEs and trauma-informed language in city documents and RFPs when applicable. And just report out, I really appreciate that you all brought that up last year. And one of the successes that we've been able to have with that was that the city is charged with the physical and mental health of the people, and that includes individuals that are incarcerated in our Davidson County jails. And so in order to accomplish that, we actually issue an RFP, and then there are companies that will bid on providing that medical and mental health service. And within that, this past year, in the RFP, we included the stipulation that the provider would utilize trauma-informed correctional health standards. So that is something that we were able to do in terms of a success for that. And I just wanted the committee to know that. And I also wanted ACE Nashville to know that and how much we appreciate you bringing that forward last year. It really has made a difference, and we'll continue to look for opportunities to do that in the future.
Mm-hmm.
All right, thank you, Angie. Anything last closing remarks, Charity or anything?
Just that we want to say thank you for your time, and we appreciate the support wherever it comes from.
Yeah, thank you very much for your time and your support.
Yeah, we appreciate your presentation tonight. Thanks for the update. Okay. We're going to move into item 4. Dia Carrillo, who is the Cmhsi Coordinator, is going to facilitate much of this section for us. And in the same way that we asked Judge Callaway to be our council champion tonight for the previous presentation, we've reached out to Jamison Norton, who is CEO of Vanderbilt Psychiatric Hospital and Clinics, and to Senior Judge Retired Judge Eisenstein, General Sessions Court and Mental Health Court, and Mental Health Advocate to be our champions for the CMHSI, I never get that right out, section this evening. So, Dia, are
Great.
you going to kick things off?
Great. Well, good evening, everyone. And I hope everybody can hear me. We're sort of sorting chairs right now and minding social distance here. I have taken my mask off, but such are the sign of the times. I want to thank Bob Barrow and Angie Thompson for this opportunity to present to you. Earlier you received a memo from Amanda Brock and myself summarizing the accomplishments of the 24/7 Crisis Treatment Center, as well as providing an update on the Community Mental Health Systems Improvement Network. And I'm just going to briefly go through just some of the amazing accomplishments in the Crisis Treatment Center. I think particularly today, as we'll hear from Judge Blackburn later on, that the Crisis Treatment Center is very much an example of what we hope Metro Nashville will always be investing in. I think from the memo we can see it's remarkable progress in just the last year and a half that it was launched. It launched in February of 2019. And what we now know is that drop-off hours for Mnpd have dropped to 10% of what they used to be, which means that Mnpd, it is estimated, and my understanding is this is a very conservative estimate, but they are saving close to $50,000 annually. They are saving nearly 1,100 hours in FTE time by virtue of having this open up, which is important because we've got clinicians working with individuals in crises, and we have Mnpd doing the things that they do best. If we look at overall admissions since 2017, which would be before the launch of the CTC in 2019, we can see that admissions, crisis treatment admissions increased by 157% since 2017. And they are now at 2,946, up from 1,145. 61% of all admissions in fiscal year 20 this year were uninsured. So we know what's important about the CTC is that it is providing needed services. It's reducing Mnpd's investment in pre-arrest diversion. If we look at a nice savings to the local jail system based on the average length of stay for someone who is known to have a mental illness, we can say that what we're looking at is a savings of around $2.3 million. So there's no question that the Crisis Treatment Center is successful, and we look forward to its continued success. Certainly COVID-19 has created a bit of a wrinkle in how we all operate, and so the Crisis Treatment Center did have to reduce the number of beds to accommodate social distancing requirements this year. Still in all, it's back up to 12 total beds, and it keeps increasing the number of individuals that it sees, despite some of these limitations due to the pandemic. I'm going to stop there. I just want to be sure that Pam Womack, did you want to highlight any other successes here on the CTC before I go on?
Well, I was just going to say, it's not only the pandemic that we were suffering, but also the tornado hit, and that put certainly a lot of pressure on us. But, we're really proud of reducing the police time. I mean, when we started this, it was over 100 and something hours that some police were staying at the crisis center, and it's down to 8 minutes now. We've seen the indigents go up, people with no insurance, and that's okay. That's what we're there for. And we have gone, like you say, from 20 beds in our crisis treatment center, 23 observation hour beds, down to 8, and now we're back up to 12. So even the statistics that you noted for the last few months are reduced because of just the capacity has had to be reduced because of social distancing and having people come in and wear masks. I mean, it's really, and I'm sure Jameson can talk about this too, but I mean, coming into an emergency room and having a psychotic person put a mask on, and just the time it takes for the providers to try to work with that person is just, unbelievable. So we're really encouraged with our partnership with the police. I mean, you may have seen on the news the last few nights that Interim Chief Drake is talking about a co-response type of approach for mobile crisis to go out with the police. So I just think this treatment center has really opened up a lot of avenues for working with law enforcement, and just the public perception of the mentally ill with the police has gotten a lot better. So, that's what I wanted to say. Thank you for asking.
Absolutely delighted to have you share your remarks with us tonight. Thank you, Pam. I'm going to move on to the update on the Community Mental Health Systems Improvement Network. And because of the success of the CTC, it really, as many of you know, Cmhsi helped to, 5 years ago, helped to support the creation and the movement towards creating the CTC. And of course, Cmhsi was instrumental in getting this council off the ground in 2018. And so with some success, under our belts on that, it meant that the Cmhsi had to go back to the drawing board to figure out what might be some next steps. And so as we walked away from the drawing board, we were very fortunate, first and foremost, to receive some consulting resources from the Center for Nonprofit Management to really help us through a design period this year over the last 5 months to do that. And we've emerged with a new overarching goal, which is to reduce the number of social, emotional, and behavioral health crises requiring intervention in Metro Nashville. And we now have a strategic framework that allows for us to work on 4 broad objectives. The first is we are going to continue work on pre-arrest diversion. The second one is early intervention, specifically looking at youth, children and youth. We also are very interested in looking at post-intervention discharge supports. And then finally, we have a very invested cohort that really believes it's time for Metro Nashville to begin the process to develop supportive housing. Each of these objectives are co-chaired by our colleagues, and they will have their first meeting this month, in the month of October. And their first assignment is to identify 1 to 2 action items for this fiscal year so that they can flesh out what we'll be doing on the common agenda, which was the last page of your memo. So that concludes my remarks, and I'm going to open the floor to Jameson and Dan.
Thank you, Dee. This is Jameson. I just want to take an opportunity to applaud the work from this group. The objectives and really the principles are so consistent with what even the things that we've heard tonight from ACEs, and the idea of being able to provide early identification and interventions. We know how it creates an improved outcome. As with Vanderbilt, we've got a full continuum, and so see it across those bookends and know how critical it is to be able to identify early and support at the right level of care at the right time. And I think the work of this group in phase 2 is going to make a big difference. In the wake of COVID, we've seen a progression of fatal overdoses. We know that this will create levels of trauma, particularly among children and adolescents, and being able to anticipate that and provide both prevention as well as discharge support options beyond what we've done in the past, I think will make a big difference. Also very excited about the housing initiative. We know how just housing instability has progressed, and we know the social determinants, how they have led to poorer outcomes. And these are really challenging situations that will require close, cohesive collaboration across the community. And these are the types of goals that are going to lead us in that direction of providing, of working together in concert toward really unified goals. So thank you for the great work, and really excited to support in all ways.
Thanks, Jameson.
Am I up?
Dan, we can hear you.
Yeah. Jameson, thanks for your comments. I concur in everything you have said. As Pam knows, I've worked very closely with Pam and Amanda on the walk-in center and the pre-arrest diversion program. And I want to say how proud I am of Pam and Amanda and her staff. They have done yeoman's work and made great progress in the short time they've been open. And my observation is, and this isn't going to come to any surprise with Pam, is over the last couple of years, they've expanded the range of their services, such as they're doing a lot more medical and interventions for people that are more seriously ill. And as a result, their costs have gone up dramatically. And an ongoing problem is funding to keep up with the costs of personnel, expanded personnel, and just running a 24-hour center. And I see that as a big issue that we're going to have to face. And of course, Metro is getting a great benefit from their services by keeping folks out of jail and keeping people out of the hospitals, which goes to the state, saving a lot of money, and medical community. But they have stepped up to the plate, and we call them now the front door to the mental health services, and that's really what they are. I think the next step in this progression is one that is going on now, and I'm sure we're going to hear from Judge Blackburn, and that is the response to crisis and the model that's going to go forward. Obviously, in Nashville, the model has been the police have responded, which causes some issues, obviously. And I think now the movement is toward mental health people taking the lead on that, with the police being there to, or security, some sort of security, because these are very volatile situations. But I'm going to be interested to hear from Judge Blackburn where that's going. But I think it's moving in the best direction, and hopefully will continue. The other thing that Jameson touched on that I think is really important, and I know Robin's on the call now, I know she does too, we've talked about it a bunch, is having the ability to expand services. Once you get somebody into treatment, is have ongoing services at the highest level, as well as supportive housing. And I think housing is very critical to keep people in treatment and keep them off the streets and keep them out of the jails. So those are the four things that I'd like to present, and I'd like to hear what Pam has to say about that.
Oh, I agree with you. I mean, I think we're very appreciative of the PIP money that we got, several years ago. And the reason we've been able to take more acute people from the police is that we've been able to staff up and have staff meet them at the door and do the assessment right there. And that takes, additional staff with not only the mental health techs that help us, with very, volatile people, but also having, 24-hour psychiatric or nurse practitioner provider, status. So it's just a never-ending cycle. When we are on the Commissioner of Mental Health's radar, that's what I would say. And I think we have done a really good job of. I mean, we told the the council several years ago when this first started that, part of our goal was reducing the police time. And I think everybody knows that, 8 minutes for police just to walk out of the car and put somebody in our care is, really all it takes now. So, I'm just really appreciative for the council's support. And I think this has really been a great thing for the city of Nashville and County of Davidson. It's really helped a lot of people. And, we want to continue to be able to do the work that we need to do. And I do agree with Jameson on the housing. I think particularly with COVID, one of the things we've had difficulty with is so many of the places, and I know that your emergency room, Jameson's having the same problem. People are staying longer with us because the disposition to put them in housing or to put them in another treatment center with COVID, they're, requiring tests and everything just gets delayed. So everything's backing up because of COVID. So one day when this is over, I think it'll be a little bit different story, but we'll still have, have to staff up like we are now.
Anybody got any questions or comments that they'd like to make at this time?
Well, thank you. Jameson, Judge Eisenstein, thank you for championing this presentation. Pam, again, thank you for your work, and glad you're able to join us tonight and add some very relevant updates
Sure.
to the information that we have as well. Thank you.
Of course.
We want to be mindful of our time right now. We have a little less than 20 minutes before we expect Judge Blackburn to join us. Angie's going to introduce Josh Love at this point for the next presentation. Josh is joining us remotely as well.
Thank you, Bob. You'll recall last meeting, that Trevor Henderson and Josh Love presented to us on the opioid overdose crisis in Nashville with some very interesting and somewhat startling statistics. And as a part of that, they made a commitment to provide ongoing reports to the BWAC. So tonight, Josh Love is joining us again. And just as to remind you, he is the epidemiologist with the Opioid Overdose Response and Reduction Program. And so I'm going to turn it over to Josh now to walk through the report and then get some feedback from the council. So Josh, I'll let you take it away.
All right, thanks, Angie. Thanks for inviting me. Again, as Angie mentioned, we presented some data at the last meeting. And prior to this meeting, I believe Dia sent out a brief report. Again, what I came up with is a high-level and timely report to provide awareness on this crisis in near real time. In total, there's 6 slides. It contains the structure of which is a summary slide, and then it breaks down each of our 4 primary data sources that we use to keep a pulse on this epidemic. And then the last slide contains contact information. Yeah, can you guys hear me?
Yes.
Okay, Bob was waving at me. Okay, all right, so I'll continue. So anyway, if we walk through this, as we see, it contains our fatal drug overdoses, which we capture from our medical examiner data. Those drug and opioid overdoses that are reported by healthcare providers, what we see at the local emergency departments, and then when our fire and EMS go out for a suspected drug overdose. And I've broken those down by month and compared it to the same time last year. So all of these data presented here between January 1st and September 19th. In each section, I contain the last 12 weeks of activity, so we can kind of see how things have been in a more recent sense. And then broken down by sex and age group. And let's see what else. So yeah, that's what I came up with. Again, it was to try to keep it straight and to the point. I mean, I have other, reports that get into far much more detail, but just so you guys can have a quick overview of what we're seeing. Especially to help drive you in your respective efforts and what you guys are out there doing in the community. So yeah, I just wanted to reach out and see if you guys had feedback at this juncture, if there was anything that you would like to see that we could in turn provide. I would ask if you guys are using this information to go to the media, please, we would prefer that you contact our team, Trevor and I, prior to, just as a courtesy. And yeah, so I mean, I'll open it up, see if you guys have any questions.
Josh, I'm sorry, I don't have the data. Is it presented somewhere?
Yeah, can I have the ball, or is somebody and we can pull the PDF up? I have it on my computer.
Doing that now.
All right, thanks, Kevin.
Jameson, you should find it as an attachment to your meeting invite.
Great, thank you, Bob.
Okay.
Yeah. Okay, let me share this. All right, it should be up. Okay. So as I said before, this is a high-level summary. As you can see, at the time of this report, which I produced late last week, we were at 446 fatal drug overdoses. Last year, we had a total of 468 for the entire year. So we're coming up on that number here quickly. We see a lot of, so far this year, over 80% of the completed toxicology reports, we have found fentanyl. So that's a real alarming trend. And on the whole, compared to last year, we are far outpacing what we saw last year across all of our data systems and metrics. As you can see, of course, with our fatal drug overdoses, but then also in our emergency departments, and then of course the burden on our EMS. As you can see, the monthly counts, and then when you go to those respective slides, you can see how much they're responding to each week.
Is September a partial month of data, or did I see that it's actually going down? That month is the only month that has been below last year's in fatal overdoses, or is it just a partial data month? I wasn't sure.
So with that, there is a slight delay. All these are at the time of when I extracted the data, which was September 24th. But yeah, okay. So far this month in September, it looks to be not as the same amount as last September of 33. Yes. I will also add, and I made a note in here, but the reportable drug and opioid overdose, there's approximately a 2.5 to 3 week lag on that when we get it from the state. That's just so they can update their data. So that's always going to be a few weeks behind. Meanwhile, the other data sources are much more timely and yeah, much more timely. Now let's see here. So as you can see, this is the general layout of each of what we're looking at. Last 12 weeks of activity, a cumulative total at the bottom to show folks where we were last year compared to this year. Again, you can see the percentage broken down by sex and age group. And then weekly counts comparing the last 2 years just overall. So as you can see there with our EMS runs, we were averaging about 84 runs per week. This year we're up to 120. And then of course with our emergency departments, again, up compared to last year. And you can see those weekly averages. We did, as we discussed in the last meeting, we did see, COVID's impact on this amplified what we were seeing already. And then, yeah, so I have a note in there. Yeah, and then again, with our fatal drug overdoses, we're averaging about 10 fatal overdoses a week currently. And then compared to last year, I mean, we're just way far ahead. And then the final slide, again, that shows the contact information for Trevor and myself, a link to our page on the Metro Health Department website where you can find our quarterly reports and other information. It breaks down the data sources that we access. And just a couple caveats. And then we always put in red at the bottom, if you do learn about unusual overdose activity, please contact us. We have a dedicated email and phone number.
Josh,
Does anybody have any questions?
Yeah, Josh, this is Bob. I want to follow up on Jamison's question because I had the same notes in all those other categories, right? Non-fatal drug overdose, 3D visits, suspected drug overdose, reportable drug overdose. September, right, September is significantly down in all areas. I mean, the delta is pretty dramatic, and it could be. Jamison, it may just be all attributable to delayed reporting or partial capture, but if you follow up with this group, just a note might be helpful if you see something once you get several days into October that changes this. We'll all see the update, I'm sure.
Yeah, absolutely. I mean, it's important to remember these are live databases that we're dealing with and are subject to change. This is representative of data at the time of extraction, but yeah, it's a good point. I mean, stay tuned. I would put more emphasis on August and prior if you want, and kind of see. I mean, we're October 1 now, to kind of wait for the rest of the data for September to fill in. That's part of producing very timely data in this case. But thanks for pointing that out.
And Angie's noting as well that the report, we should all know that the report is, your update here was 9/25.
Yeah.
And we're sitting here on October 1st, looking back at data.
Josh, we appreciate the great work from you and Trevor.
Yeah.
This helps keep everyone aware and responsive as this epidemic and pandemic, as it continues to progress in our community, keeps us all responsive to it. So thank you for the work that you're doing.
Much appreciated. Thank you.
Okay, Josh, thank you. All right.
All right,
Anything else for Josh? All right. Angie, survey?
Sure. I wanted to just give you all an update on the BWAC survey. We had talked about surveying to look at the impact of COVID-19, and that survey is currently in beta testing. And I want to really appreciate the work that Bob and Dr. Stovall did to help develop the survey. Once that beta testing is completed, it'll be distributed to all BWAC members. We did find a few things that need to be altered in that. And not only are they looking at just running through the survey, but they're also looking at completing it. So we're looking at how feasible is it to gather the information that's being requested, as well as how much time is this going to take. So we want to make this a survey that is useful, not burdensome, but we know will require some definite investment of time. So as I said, we're working through some corrections now and are focused on having this out as soon as we can. And Bob, and I'd invite you and Jamison, Dr. Stovall, to just make any comments on this.
Yeah. Jamison, recognized that you spent some time on that last night as well. I think it made some early discoveries. Look, we know we're asking, it's a substantial survey. So giving you a heads up about that, I think Jamison will say the same thing. When I asked for this to be completed at Centerstone, I had our quality VP do this, but also had our VP of Finance sitting next to our quality VP, because I knew that several of the questions were going to require some investigation and some comparison in terms of financial performance as well as service level data. So you may anticipate that. We found some issues just in a dry run of completing the survey yesterday, have passed those on. So we'll make those corrections. I know that Dr. Stovall and Jamison are doing the same thing. And as soon as we collect feedback, Jamison will incorporate your findings as well, Jeff, into the survey. So I think from pushing this thing out in terms of a beta, we've already gotten some traction that we're hoping to get. And by the time that it's in each of your hands, hopefully you're not running into nuances that cause some confusion or a real lack of clarity maybe in some of the questions that we've asked. So that's the refinement process we're in right now. Again, as Angie said, with the hopes of getting this thing out quickly. Yeah. Jameson, Dr. Stovall, any other comments on that?
I'll just note that I think it's going to be a really meaningful effort. We have talked about the impact from COVID and among all of our services about, what we're seeing among our patients and everything from readmissions to not being able to access the critical resources that they've relied upon for many years. So being able to understand what at which points in the continuum of care and where in our health systems we're experiencing the most challenges will be very helpful to help reinforce and work together, empower each other, and to find ways to work toward really meaningful solutions. So I think it does that. It's a great starting point for us to better understand the impact from this crisis.
Great. Okay. And I did see that Judge Blackburn has joined us. So Judge Blackburn, welcome.
Hello.
If I can, I would love just to highlight some of your background for this group. I know that I would imagine everyone here is, Judge, familiar with you, but I would just want to share some things from your bio with this group. So, Judge, you were elected to Division II General Sessions Court August 7, 2014. I think most people know that Judge Blackburn's a graduate of David Lipscomb High School as well as Lipscomb University. She's a Nashville native and attended the Nashville School of Law. Following graduation, we know that you decided to practice law in General Session courts across Tennessee and very, very extensively in the Nashville area. Prior to Judge Blackburn's election, her focus in law was in the area of employment law, a true advocate for employees who felt workplace discrimination across many issues, but especially around unfair wage practices. And Judge, we also know and thank you because we know you to be a strong advocate for children, especially children who are victims of child abuse and child sexual abuse. So thank you. In your responsibilities, true outside of General Sessions Court, we all know you dearly as our judge of the Mental Health Court and Veterans Court. We want to acknowledge that and thank you for that this evening. But I also wanted to make sure people were aware that since taking the bench, you've established the Davidson County Mental Health and Veterans Court Assistance Foundation. And I think the significance here is the effort that you led to support, to secure funding for the Veterans Court in the Tennessee legislature, making Tennessee the first state to provide such secured funding. And we all know, too, that in December 17, you were elected by your colleagues as a roll vote of confidence to serve as the presiding judge of the Davidson County General Sessions Court, and that you were reelected to that same position in 2018. I found a fun fact in some of your community involvement and some of your leadership, and that was that you developed the Women's Build program for Habitat, where annually you bring together a group of diverse women leaders to build a home for deserving women in Nashville. Thank you.
It's fun.
Yeah. Those of us that have been on Habitat projects would agree with you. They're a lot of fun, and what an opportunity to do something meaningful for a family in need. So, hey, welcome tonight. I said a few things before we launched this meeting about your work, obviously on the Mayor's Policing Policy Commission, but in particular, you're being asked by the Mayor to lead the Communities Committee. And it was really acknowledging the work that you're doing with the commission at large, but the communities committee, looking at where there may be some opportunities for this council to make sure that you have the council, the expertise, the opportunity to interface with us so that we can be a benefit to you and to the mayor in this work, and to look for interface opportunities as the work of that commission continues and our work continues. So want to make the floor yours tonight to give us an overview of the commission's work as well as your committee's work. And then let's open it for questions as you've had a chance to do some level setting with us.
Well, as I'm giving you this information, put one thought in your head right now. Think of any questions that you would like asked of the next candidate for chief of police. Right now, I understand they have 57 candidates. And the 5 individuals that are on that team are going to narrow it down to 20 and then begin the interview process. But we are able to ask the interviewees questions and pose questions to them. So coming to it from a health and mental health standpoint, we can ask that next potential chief questions that we haven't been able to ask before. So if you have questions that you would like posed, please let me know. One of the big things that have come out of our discussions so far have been trust. That's been one of the big topics. And a lack of trust in the community with police, the neighborhoods, the individuals, and feeling like we need to build trust between the officers and people in the community. And in looking at where we're headed, and I'm hoping, I'm going to tell you where we think we're headed right now, but I want you all to tell me where you think we need to be headed. So far, the main topics we're looking at are community policing. I can tell you right now, there's going to be a recommendation from our committee to begin community policing. Currently, there is in West Precinct, and there has been for about 2.5 or 3 years, a group of individuals, I want to say there's 6 or 7 officers. They took one of their, not squads, but whatever, groups, and they became a unit of doing community policing. It took them about 18 months. It was at 40th and Clifton was the specific area of town in that West Precinct that was a hot spot. And they were trying to figure out how to unravel it. It was just a high crime area. Nobody felt safe. There was one grandmother that told us she didn't feel comfortable bringing her 5-year-old granddaughter into her home to eat because she was afraid of what would happen. Another woman said she could never sit outside on her front porch. So the neighborhood was obviously a very high crime, high drug area. Well, because of the efforts of this team of individuals, there's a woman, they're Black, they're white, they're Hispanic, they're old, they're young. It's just an interesting group of officers. And they have put together a team working together doing community policing, which what that means is they do not respond to calls. They work walking the streets, walking the neighborhood, getting to know the business owners, getting to know who lives in what house and who they are and what car is supposed to be there and what car is not, and getting to meet and talk with everyone in the neighborhood. And through that effort, crime has been lowered 47%. People feel comfortable sitting on their front porch. The grandmother now can bring her granddaughter into her home to have dinner. It's totally changed that entire environment in that neighborhood. And because of listening to these neighbors and listening to these people, they have brought trust back between those officers in that neighborhood. And it's totally changed the whole atmosphere and the whole conversation. And we all feel very strongly this is something that needs to happen in hot spots around Nashville. Not in every neighborhood, but we need to, a neighborhood by neighborhood, look at neighborhoods in each precinct and figure out where we need to implement this and start to turn around some of our troubled neighborhoods and figure out how we can make changes. That's one thing that we're looking at. Another thing that we're talking about, and we heard tonight from Ellen Abbott at the state of Tennessee, and Amanda Brock came on after Ellen and discussed it as well. We feel very strongly that we need to implement CIT in Nashville. It's in Memphis, which is where it started, the Crisis Intervention Team model. It's in Knoxville. We know that there's funding available to start it. And obviously, we all know Nashville has no extra money floating around. The police department sure doesn't, but are funds available through grants that we can use to train the team and train the officers here in Davidson County. And we feel like that is an important piece. And a lot of you listening to me tonight are part of those organizations that would be asked to participate in this process. Your mental health providers. You are going to be those organizations that are going to be part of the framework of putting this together. But we feel like that's an important piece in changing the conversation around mental health and police here in Davidson County. The people that I see in mental health and veterans court don't necessarily have to always come through that courthouse door. And I think in combination with the CIT model, with working with the mental health co-op, also we have a sheriff's department that has 40 beds in it now that are sitting there that are diversion beds that we can also use. I think we've got resources that if we put our heads together with this model, that we can divert a lot of people before they ever come into being arrested. They can be diverted and they don't have to come into the criminal justice system. And I know I can't see Judge Calloway, but I bet she's over there shaking her head. Hello, I hope you're feeling better.
Thank you. I'm feeling great, and hearing all this is wonderful. I know Pam's on here, and I know she's doing a bunch of flipping over there.
I bet she is too.
This is great. This is awesome.
Pam, I've got to have you behind me on this one. Good. Well, it's going to be in the recommendations. I guarantee you that. And Ellen has explained to me how I can get this $5 million at $1 million a year to bring this to fruition. So we're going to make it a go. I know it's not very popular with one of our law enforcement folks here right now, but we're going to figure out how to change his mind because it's going to be in the recommendations.
Great. That's good. Good.
So that's what we're coming out with right now. So you all tell me what you think needs to be in our recommendations from a community standpoint.
So, Judge, this is Robin Nobling from NAMI Davidson, and you just made me really happy.
Well, good.
You know, this is something we've been looking forward to, and yes, we will help change minds in any way we can because I know what you're talking about. So,
I thought you might.
Yeah, whatever we can do, you know, wherever you need us, wherever our families that have experienced this can help, we'll be there.
I'm counting on you because you're a component of this whole thing, as you well know.
We're in.
Thank you.
Judge, I don't think you can see the rest of the head nodding in excitement and agreement, but I think there's a collective sense of appreciation. I know there's a collective sense of appreciation for your committee's willingness to put this forth as a fundamental and solid recommendation.
Absolutely. We've been preaching this ever since this, or at least I have, ever since this council was first formed. And, I'm from Memphis, and so it's just really hard to see Memphis have something like that and be so much more advanced in their police work with the mentally ill than we are. And I'm so glad that other people are now understanding that and really wanting, that goes along with community policing too, because CIT is more than just the police attending to the mentally ill. It's, their community involvement. It's their being on boards. It's being involved with NAMI. It's, helping set policy for how they're going to operate with the mentally ill. It just changes everything. And it's going to take a while. But
It's hand in hand.
Just to hear you say that and have everybody get behind it, I mean, we can do this. And I think there are law enforcement that will want to do that. I mean, the CIT group are people who volunteer because they have a passion for people with mental illness, and every police person doesn't. I see them as like a specialty group. Yes. I see them as a specialty. I mean, all law enforcement is trained in some components of the mentally ill, but the CIT are the specialists. It's just like medicine. All doctors are trained in something, but the specialists are the ones that really gravitate to what they want to do. And it's just great. I just have to say this. I heard when one of the Memphis police were talking to the Nashville police, I was there, and he was saying that he was really against CIT when it first came to Memphis. But he was talking, and he was a foot cop, a patrol cop on the beat. So he was talking with one of the CIT officers, and he said, he told me, he said, we don't have to chase anybody through the parking lot. We don't have to run down robbers. We just like sit on the curb and talk with somebody who's mentally ill. And he said, I knew right then I wanted to be CIT cop because I was tired of chasing robbers through the neighborhood. So it was just things like that it just have spoken to me. And I think there'll be enough officers who will want to be on a CIT patrol. I think it's just a great idea. I'm so thankful. Thank you.
Well, the way it's been presented to us is the interviewees for this position will be told, not asked, how do you think about this? They will be told, this is what Nashville is going to do.
Oh, great.
Are you willing to do this?
Yes, Mom.
If not, we're not going to hire you.
Yes, great.
Oh my gosh, that is so wonderful. The other thing, this is Robin, the other thing I want to make sure we do, because this is part of CIT, is, you got to have the housing. You've got to have those other community supports. That's what helps to make it work. So the police are the entryway to it, and the police feet on the ground and having those relationships in community policing makes a big difference. I've been out to Memphis a few years back, more than once, to be, talk to their CIT people. And but I love what somebody said, and that is housing is healthcare. And so that's a part of mental health care too, is housing. So yeah, let's do it.
Judge,
Yes.
this is Dan. How are you?
Good. How are you?
Good. I want to say how proud of you I am. You've done such a terrific job. And if you can get CIT here, you've accomplished more than many of us have done in many, many years. And I applaud you on that. One thing that that I think I talked to you about at some point is part of this. Will mental health, will there be units including mental health providers or professionals that will work directly with the police, such as they have in Memphis with a CARES program? And I know Amanda has talked to the acting police chief about that. Is that part of the discussion also?
Well, Ellen tonight mentioned that there are ride-alongs in Knoxville with mental health care providers that ride along with those officers in Knoxville, because during the times that they think are peak hours, because they'll run across people that they haven't seen, and they'll make appointments, and they'll try to figure out how to help them right then and there, and not wait for them to go off the rails.
Right. Well,
And
I think that's really important. I know that, that they've been working on that recently.
Right.
In Memphis, Pam, you correct me if I'm wrong on this, their CARES program has EMS, police, mental health, and Anybody else? Was there another?
Well, yeah, no, fire, but that's EMS.
So they theuse it. It might be the sheriff. They have units that respond that way too. So there's some models that you might want to look at that are around, even in Tennessee and some of the other states. As long as you're trying to develop a plan, it might be interesting to see what other areas are doing.
You don't get to sit on the sideline.
Say what?
You're involved in this too.
I know. And you know, I'll help in any way that I can.
I know, but it's going to take all of us to get this done.
I know, but
Somebody's got to.
I'll be happy to help in any way I can.
Thank you.
You're doing a great job, and
Frankie
I'm
Sheriff.
particularly proud of the development of your Veterans Court. I think it's been wonderful. You've done a terrific job, as well as with the Mental Health Court.
Well, thank you. I had big shoes to follow.
No, you didn't. You had little ones, and you came in and were big shoes. So congratulations for all your work. You've done a great job.
Well, thank you. But it is going to take every single one of us to get this done. And somebody, as I said, has to go talk to the cranky sheriff. I've heard he's not a proponent.
You got many volunteers right here. Judge Bob Bureau, I want to add another, it's already in place, but I just want to make sure, as your committee is looking at this, as we're thinking about interviewing new police chiefs, couple of decades ago, right under the guidance of Carol Etherington, as we all know, we created the Victim Intervention Program as well as Police Advocacy Support Services. And that was really a landmark statement of creating a support system for law enforcement and their families. And I just think, the work that PASS has done on behalf of our men and women in uniform and their families needs to continue. I think we need to recognize the great work that's been done and continue to look at how we as a city need to continue to resource that area. PASS has done tremendous work in that direct care. They've done great work interfacing with the academy. I was privileged to be part of that group for about a dozen years and really had a chance, especially these days, when there's so much divisiveness between our just divisiveness in terms of, how people are looking at law enforcement, really to truly know the devotion, the commitment of, 99.9% of our officers and the commitment that their families make to that profession needs not to go unrecognized. It needs to be supported in terms of making sure that we as a community continue to have the supports in place for them.
There is one committee of these three that is specifically looking at that area. That is their entire charge. Is to look at officers' well-being, their mental health, and all those components. But I agree with you.
So, Judge Blackburn, this is Angie Thompson. Thank you again for being here tonight, and thank you for your leadership in this. One of the things you said was we could offer questions, and so we'll get your email out to the group, and so they can go ahead and send their questions directly to you. The other question that I had, though, is what other groups do we need to engage with in metro government, outside of government, whatever, to become champions to support this work?
And looking at the CIT model, hold on one second, let me get it. These will come along later, are the universities. Once we get it up, we'll need to engage with each of the universities and their police departments. To start off with, obviously, all the behavioral health groups here. All the emergency services groups here. which those are easy. Those are all pretty much based out of Metro. I'm curious. I don't think there are any other CIT groups. Obviously, Ellen will know this in any of the other outlying counties. She didn't mention any in any of our contiguous counties. The only ones she mentioned to me were in Memphis and Knoxville.
I believe there is one in Rutherford.
Yeah.
There is one in Rutherford.
Judge, there's several around, and
Yeah.
You can get that information from NAMI Tennessee, Jeff
Mhm.
Layden, and Robin, who is the,
Kim Rush.
Kim Rush
Kim Rush is doing CIT and
Yeah. So
I
they've
know-
got a complete list of
yeah.
all the CITs in
In
Tennessee, plus the ones that are signing up to work on it now. So there are several, but you know, they're a little bit different than a big city. So,
Yeah. Well,
but there are a bunch of them.
Jeff is somebody I need to reach out to anyway.
Yeah.
That's a good name.
Well, and I think it's important when you look at CIT to look at the individual programs to see if they're carrying them out fully, that they're not just carrying them out as police programs, that they're carrying them out with the full intent of the community CIT program, because that's what makes it effective. That's why Memphis works. And so if you only leave it to the police, you're not supporting those police. You're not stopping the revolving door, and it's the complete program that helps to stop the revolving door.
Yeah, Jackson is about the closest to Memphis that I've seen. Jackson, Tennessee. They train. They are a training site for CIT, and I think Robin's right. What we found out is a lot of these counties that say they have CIT, they have the training, but they haven't really. They don't embrace the whole thing.
Right.
So Jackson does. They train. I know they're a training site. And Memphis, of course, that's where it started. So
that's what Ellen suggested, was to have Memphis train Nashville.
Yeah, right. And boy, don't you know that's going to go over big.
Oh,
well, maybe we could sneak it in the back door and use Jackson and Dyer's.
I think we really need Memphis because it's urban.
Yeah,
you're right.
Jackson's just different.
You're right.
Because I actually went with the Nashville police to Memphis about 5 years ago, and it was not good because we were trying to get them to be, to get into the CIT mode, and they just kind of sat there and said, yeah, we'll do it. We came back, we never heard from them again. So it's just a new day now, and it's so great. It's just like the veil's been lifted. So I'm just ecstatic.
Well, and the mayor is going to be behind this, which is going to be the key.
And that's the key. What we heard from Memphis was, you rarely can get back then, you couldn't get the police chief to embrace this. It really had to come from the mayor. And that's what happened when they had that shooting of that young man that was mentally ill. It was the mayor that said to the police chief, you will have a CIT program.
Well, and that's where we're going. This is,
I know.
Send it to the mayor on the 14th.
Yes.
Then it will go from the mayor to the police chief. So,
yes.
Those are the elements of what it's law enforcement, it's advocacy, it's behavioral health, it's community ownership.
Mm-hmm.
And I really think too, by putting the community policing in it, it mirrors it so well, because you're out there, you're working with people, you're in the community, you're going to know the individuals that are having issues as well.
Right.
Yeah. When I talked to officers from Memphis that were doing this, that were CIT officers, they knew the people on their beat. They knew the people with mental health issues on their beat. They knew when they'd been in, they knew, of care. They knew when they came out. They knew, what they were supposed to be doing and how to, encourage them and what to do to, keep them talking and out of jail. So it was great. It can be done.
Well, and I can see how it will make such a big difference, because when I see them in mental health court, I know who's off their meds
Right.
instantly. Exactly. And it's all about making sure they're back on their meds. They're sleeping where they're supposed to be. They're eating. They're going to their appointments. And if you see someone out in the community that's not, you can stop them from having that next issue or beating somebody else up or doing whatever they're going to do and stop that from ever happening.
Right.
And I think one of the main things is it's all done with dignity. And that is so, so very important.
Right.
Well, please do think of questions to ask. One of the questions that has come up, and it's come up worded in different ways, but I've narrowed it down to this. How do you establish a level of trust between police and citizens? And assuming you're walking into a neighborhood that does not trust police, and we're about to start community policing, how would you, as the police chief, start that process? So that is a question that's come up. Now, feel free to go from there and come up with any questions you want on any topic. But I want to make certain that we have thoughtful questions that we ask someone to think about. I don't want us not to have any questions for him or her, because I want him or her to know that we care, we've thought about this, and we really do want to make a difference. And I know this is a population that I'm looking at, these folks make a difference.
Judge, what's the time frame that would you be best served by having those questions?
I have to have a draft of everything back by October 9th. And then I'm turning that in on October 9th. That's going to be looked at by the big committee, Mayor Dean and his co-chair. And then we're all going to sit down for a half-day sit down, go through it, polish it, and then we're having lunch with Mayor Cooper and presenting it to him at lunch on the 14th. We're not leaving the room until we present it to him. So.
Well, Angie and I are sitting here thinking, again, how can this council assist you in that effort? And we're thinking we'd be happy to survey our council members for those questions, pull those questions in, and then we'll convene the council to review those questions and then submit those questions on behalf of the council to you within that time frame. Would that work?
That would be fabulous. And any other suggestions you all have for CIT, please share them. And I look forward to working with every single one of you all and getting this baby off the ground.
Good.
That'd be fantastic.
Thank you
and
so
that
much.
way we can limit any duplication in questions for you, and you'll know that those questions have been reviewed and vetted by this council as well.
And thank you for this opportunity.
Yeah, no, thank you for joining us tonight. Thank you for the work that you're doing, and we all echo Judge Eisenstein's gratitude and his accolades as well.
Well, thank you. Good night.
Good night.
Good evening.
Thank you. It is 6:29. Any closing comments from anyone? I do want you to know that I turned and apologized to Dia when we just suggested that we would get a survey out. So just know that we're not taking her good work, her efforts for granted. So we'll work with Dia. We'll get a survey out very, very quickly. Ask for a quick turnaround. So please give thought. Obviously, you're already doing it. Give thought to those questions now. We'll have that survey provide an opportunity both for those questions and for any additional feedback, as the judge just asked, for either community policing, comments you might want to offer around community policing, and for CIT. So it'll be really three components, or maybe four if there's another open area. We'll look for an opportunity to bring us together again with proper notice. Same way we really approached all of your creative ideas around funding. We'll come together. You'll have a chance to have reviewed those questions. Let's refine the questions and then submit on behalf of the council to the judge. Does that work?
Sounds good.
Good idea.
All right. Thank you. And as always, thank you for your continued commitment, your work on this, Council. Dee, I was remiss in thanking you for the facilitation that you provided tonight as well. So thank you, and your work in always keeping us well organized here. So we will see each other again, obviously much earlier than December 3rd, as we anticipated when this meeting started tonight. Obviously within the next 2 weeks, we need to reconvene. So we'll be sending out some dates to give us an opportunity to do that, and you should see a survey shortly. Thank you and good night.
Thank you.
Good night.
All right.